welcome back to AM Northwest. Here to tell us how the zone technique could free you from chronic pain, we welcome back from Pain Relief Partners, nurse practitioner and owner Stephanie Jones, along with chiropractor Dr. Tom Kessinger. Good to have you both with us again.
Thank
you. Tom, let's go. We touched on the zones last time you were here, but let's go over them again. There are 6 zones. Explain them to me.
So there are 6 zones, which are brain centers that control different functions in the body. And there's the glandular zone, the elimination zone, the nervous system zone, the digestive zone, the muscular zone, and the circulatory zone.
Can you show those?
Yeah. So these correlate with the parts of the brain that control all the different functions.
Okay.
And it's out here by the ear, and then it goes across 6 different segments, 6 different spots, and we just press on those, and we're finding for the most tender spot. Then
you can feel how tender it is.
Yeah, and I ask the patient as well.
Okay.
And then the patient will tell me, and then we adjust the different area. And I use an instrument like this.
Yeah.
It's called an arthrostem. Basically, it's just putting an impulse into the spine and sending a neurological signal to the brain. And so we're just stimulating the spinal cord to communicate with the brain so the brain can then balance and then work better throughout the whole body.
What is the most common issue that you deal with?
Well, we deal mostly with back pain and neck pain. We've had patients with sciatica, carpal tunnel, and different pain responses like that. But we also have a lot of patients that are multifaceted patients. They have a lot of different pain, different things. So some patients have depression, some patients have chronic issues with digestion and things like that. And so this type of therapy can not only help with the back and neck pain, but also help with all these other different conditions that people have.
Let's say Stephanie has sciatica. Where would you use that?
So we would do just what I did,
Yeah.
and we would assess which zone it is, and then I would adjust the zone. So if it was zone 1, which is really common,
Okay, that's the back area.
We would adjust 4 different segments, just kind of like this.
Right.
And then.
And how does that feel, Stephanie?
Fine, it's just a gentle little tap.
Just a gentle tap. And you've experienced his treatments before?
Yes.
And what is the feeling in general? Just it's not uncomfortable? Doesn't
Oh,
look
no, not uncomfortable at all. And
Yeah.
I'm usually lying on my stomach, and he does what he just did, assessing,
Right.
and then depending upon which zone is the most tender, he'll treat different areas of the spine.
Let's say, using that example again of sciatica, so how many treatments usually to treat something like that?
You know, some of the patients will be closer to 12 visits, but everybody's a little bit different. We had a patient just recently that within 3 visits, their sciatica went away.
Oh, wow.
And that's really fast for sciatica. Had other patients with carpal tunnel within 3 visits. Yesterday, I had a patient that after a spinal surgery in his cervical spine, he had numbness in his hands, and one adjustment, before he left, he could feel his fingers again.
Wow. Now, let's talk about medical insurance. Does insurance cover this kind of treatment?
Yeah, for the most part. Medicare covers this, and when a patient comes in and does a consultation, we take their insurance card and send it to our billing team. They check benefits, and then we let the patient know what their responsibility is. Oftentimes it's just a copay.
You've got to be pleased with the outcome then of what you were seeing when a patient comes in and it can't walk because of the sciatica or can't feel their fingers.
Sure.
That kind of thing, right?
Absolutely, absolutely. And it's really nice to have Dr. Kessinger be able to do chiropractic adjustment, so then we can treat together, where I inject first, the muscles are more relaxed,
Oh, right.
and then he does the adjustment. Or if they're allergic to lidocaine or they really have an aversion to needles, they can go straight to treatment with him, and he's had great success treating patients with chiropractic alone.
Oh, that's fantastic. So the two of you as a team can work together to really help the patient.
Yes.
That is great. Well, we want to tell folks, if you'd like to find out more about Pain Relief Partners, all you have to do is give them a call. They're located in Vancouver, 360-975-4680. And we'll put all that information for you on our website at katu.com. Thank you both. Appreciate it.
Thank you.
Thank you.
And we'll be right